Here we go. So welcome. Venetia. Is Venetia Brissenden today will be our interviewee on Navigating a Crisis, Conversations of Change. Before we commence our conversation though, I would like to acknowledge the traditional custodians of the land on which this interview is being held and where you potentially are watching it. Pay respects to elders past, present and emerging, and just acknowledge the wisdom of to the traditional owners of the land at this point in time as well, particularly their resilience and capacity to adapt to all sorts of adversity, which I think we can probably learn a lot from. And the purpose, I guess, of bringing people together to have these conversations and to do these interviews is to try and share what is some really quite incredible wisdom from the sector to the sector and across sectors, and to try to bring people, I guess, together in a bit more of a collective way in what we're doing and how we're going about it. So so thank you, Venetia. I'll let you introduce yourself before we get stuck into it.
Sure. Okay, so I'm Venetia Brissenden and I manage a number of services, including drug and alcohol services at Thorne Harbour Health in Victoria. Usually we're located in St Kilda Road, Melbourne, but at the moment we're located all over the place. And we provide AOD services specifically to people living with HIV and the LGBTI community.
Great, thank you. And I suspect when we get into this, you might be able to speak a little bit more to how you're managing some of those vulnerable populations as well, which I think yeah, great. So the first question that I had was, what are you currently doing for yourself, the people that you work with, the people that you work for, and just the organisation generally to manage the current situation safely, humanely, and ensuring that there's a sense of dignity for everybody involved?
Yeah, good question. So I think very early on, we are a service that has a lot of volunteers. So we very early on, any volunteers that were over 60 or any staff that were over 60 or people that were particularly vulnerable due to underlying health conditions or lived with someone who was vulnerable, we got them off-site or ceasing volunteering as quickly as possible. And we moved people probably way before we had to. We moved people off site and got them working remotely, and I think what that did was signal to staff that we were really prioritising their safety, and I think because of that, staff have felt quite held from quite early on by the organisation, which I think was really important.
Absolutely.
So we really wanted to kind of shut down face-to-face contact as quickly as possible. And I think because we have historically worked with a lot of people living with HIV, and so that was really, I think, at the forefront for us, was trying to minimise any risk for people who might be immunocompromised, even when we didn't really know as yet what the implications might be for someone living with HIV. So I think that kind of helped us move into that space really quickly. So we went and sourced some tech. I mean, we're lucky, I think, that we're the size of organisation we are. We didn't have to do too much of that. I think that's been a real issue for bigger organisations, is that just getting the tech to staff to be able to work remotely. We were lucky that we could start to do that quite quickly. But we do have staff who are using their own equipment at home because you just can't get laptops at the moment. So
home office equipment, PPE.
So we did an audit very early on of what staff had at home and were they willing to use it, and could they like even their own phones, could we sort of pay the bills for a while, things like that, to try and then we managed to kind of source the kind of tech that we needed. So we kind of did that 3 weeks ago.
Wow.
And so
you're ahead of the curve.
Yeah, we were
flattening the curve, and you're ahead of it. I love it.
So I think that was good that we were able to do that. And then really from Monday last week, we've been out of the office. And and we've worked with teams in terms of, I think from a position of over communicating and over checking in is better at this stage than under communicating and under checking in.
Yeah.
And then we'll sort out, what are the implications in terms of people's days and feeling like they're spending more time checking in than they are doing actual work.
Yeah.
I think doing more rather than less initially was really important. And we've done things like really thought about all those casual conversations that people have in workplaces. How can we sort of create spaces for those? So teams have set up WhatsApp groups to be able to kind of just like have chatty conversations while they're doing other things throughout the day, which is really good. Some teams have set up or are going to set up a buddy system where you've got two people who check in at least once a day. We're thinking about things like a virtual lunchroom where people can just pop in and have lunch and have a chat,
That's cool. Yeah.
Yeah. And we actually just had a session this morning, which we're probably going to do fairly regularly, where clinicians can come in and just talk about how they're finding working in this new environment and what are the challenges. And what came up today was people, it's actually much more draining to work in this way. It's a lot more tiring. Yeah. I think you don't get that energy exchange that you do when you're with people.
Yeah.
It sort of seems quite one way. But some people are feeling like they can still do really deep work, good work. But you just need to really, all those things that we ask clients to do all the time, like be very self-aware and watch how you're traveling and do inventories of how you are. We're going to have to really get good at practicing that ourselves. And I think actually that's quite a good thing.
Yeah.
So I think we've actually been pretty good, and we've got good feedback from staff about them feeling supported and held in this space.
Right.
So in terms of clients, I think one of the issues is that we're getting feedback, but as with all AOD work, those that you don't reach, you don't get the feedback from. So people for whom this work, seeing an AOD worker in this environment isn't going to work for them, we're not going to be seeing them, and we're not going to be getting the feedback from them about why it's not working and why it's not meeting their needs.
Yeah.
So the clients that we are working with, it is managing to meet their needs in some ways. I think there's a group of clients out there who don't have reliable, don't have phones, don't have computers with webcams or phones with cameras, who we're really struggling to support. And I think there's a bit of a sense of agencies possibly batting around those clients in terms of who's going to manage the risk. And they are often the most vulnerable and high-risk clients. I'm thinking about clients particularly with ABIs or intellectual disability, or mental illness, or a combination of those, plus high levels of substance use and homelessness. And that they're the clients who really need support, and accessing people or workers through technology is really difficult. So I think that's really, in terms of our intake staff, that's really, they're finding that really challenging. And really, we're all dealing with the stress and the anxiety and the sadness and grief about what's happening in the world. And then we have clients who are very vulnerable, and we really want to help and we can't, and that's so hard to carry as well. So yeah.
Absolutely. I agree with you wholeheartedly on that last. Most of what you said, but definitely on that last point. I think we're certainly looking at developing some resources or some spaces for people to discuss that as well, because as you say, it's a lot of the things that we ask clients to do that perhaps as practitioners, as workers, we don't do so much ourselves. It's like, how do we start to do that? How do we start to deal with and process our own grief and loss, as well as holding that safe space for people who are experiencing it as well? Super important. Yeah. And I think, just listening to you speak, and it's not the first person who's, you're not the first person who's raised this, but that idea of some of the most vulnerable people are going to be hit even harder. And, this whole pandemic has really exposed the assistance. But while you were speaking, and when you were saying that, people are being kind of shared around agencies or battered around because people don't want to hold the risk, I think in some ways it presents some really amazing opportunities to go, okay, well, we recognise this. We understand that we have these people who we just can't reach. How do we do that together? Or how can we, rather than it being not mine, but actually if we all come collectively together to do this, and potentially come up with ways that, we can support people who are already living on the edge, really, particularly at this time. So, yeah, and it sounds like you've really supported your staff extremely well, which is so cool as well.
I think so, and I think staff feel that, but it may be that I'm just hearing the good things at the moment.
Yeah, exactly what you said about clients, the ones who don't like it aren't saying anything. Yeah. But I think you're also right in that sense of just seeing how things pan out, because as things change over time, people are going to have different needs as well.
Yeah.
So how do you're not able to respond to that unless you've got open communication. So yeah. Thank you so much for sharing. The next question is, how can people support Thorne Harbour? How can people support, what you're doing and what you're trying to achieve? I mean, whether that's around advocacy, being aware of language. I mean, for an example, I think people using the term social distancing, that people, we're reframing it to physical distancing. It's not about social distancing, it's about social solidarity right now, but it's about distancing. So, language, reduction of stigma. I mean, if there's any resources or volunteers or donations, anything that you, this is a bit of a call to action, I guess, for people right now. So that's what you need.
We certainly accept donations. Anyone who feels like donating can jump onto our website and do it from there.
Great.
And that would be really helpful. And if you feel like saying what you want the donation to be used for specifically, you can do that as well. So,
cool.
Because as well as drug and alcohol services, we also support a lot of people living with HIV.
Yeah.
We do community support, home help. We usually have a drop-in centre, and we're finding ways to do that differently.
Yeah.
And I think really the way that people can help is we're really happy to do secondary consult. If you're currently carrying LGBTI clients and you are thinking, is there more I can be doing? Is there more I can be talking about with them? What are the particular issues that LGBTI clients might be facing at the moment? And I think there are some. Then, definitely give us a call for some secondary consult. We're going to be rolling out a whole lot of online webinars and training, as is everyone else, of course. But
is there any other way right now?
Sign up for those. I think that would be really useful because we're only a small organisation in a way, and we can't carry everybody LGBTI, and we don't need to. We can support other organisations to do that. I think, but definitely refer your clients to our website, to us, if you think that's what they might need. As I said, I think there are particular issues for our community who gather together in, as groups to kind of affirm our identities and find support. And we can't do that now. So that makes things a bit different for us. So,
Great.
That's it.
No, thank you. Yeah, no, that was good. I might actually ask you afterwards as well, just to confirm the point of contact, and the contact details and web addresses and what have you. So if people want to do that, then they can. And then the final question is my favourite one.
Yeah, okay.
Notwithstanding obviously the great kind of, or the negative impact and the loss and the harm that has been caused by this pandemic. I'm all about the positive reframe.
Yeah.
What do you see this current situation, and what are the possibilities perhaps that can improve the collective condition forward? Be great to hear if you have any thoughts on that.
I think probably like a lot of organisations, we've been meaning to do distance and remote tele-counselling and video counselling, and haven't really done that well enough. And I think now we are, and we'll have a lot more confidence doing that moving forward and be much more available, which is actually great for us because we are a statewide service. And I think from now on we'll be more confidently able to be accessible for regional and remote Victorians, which is really great.
Amazing.
So I think that's a positive. I think another one is that we will know ourselves in very different ways as clinicians and as workers and
as humans.
And I think there will be a sense of having got through something together, and how we cope under pressure and how we support each other under pressure. I think that's a really good thing, and we will have had to have practiced. I mean, I don't know about you, but I've always I talk with clients about mindfulness and meditation and all of that. I'm now developing a practice in that because I have to manage my life at the moment. So I'm going to be walking the talk a little bit more, and I think a lot of us will be. And I think that's a really positive thing. I hope that we have more sense about what working efficiently and how we, as a sector, and how we meet efficiently and get things done more efficiently. Would be a nice outcome to have. I think on an individual worker level, I mean, we're learning things about what we need to do in a video counselling session, for example. Checking in much more with how is this going and how's this feeling for you, and not having perhaps any assumptions, but needing to check in more because we don't have so many of those other cues. And I think that's a really good thing, learning more about our practice. So so I guess the short answer to that is we will have learnt a hell of a lot about how we do things and how better to do things.
Amazing. And I love that sentiment about having to live your values and live your things that are important to you. The time is now to be doing that, and this idea of having that presence with the people that we're working with as well. I think because it's so easy to slip into autopilot and so easy to slip into habits, but because we're all in a space of uncertainty, you're so much more conscious and aware of what you're doing and doing it. So I agree with you. I think it's a really good thing, and it's an opportunity. It's a forced opportunity, but it's still an opportunity to really reflect and see whether we're still aligning, whether our actions are still aligning with that.
And I think also maybe learning what we need from a workplace and a workspace, I think we'll be clearer about that, I think. But also, I think not just as a sector or a state, but nationally, the government has had to is putting more money into AOD, mental health, and general and family violence, particularly. Actually, have they mentioned AOD? They've mentioned mental health and family violence. I'm assuming AOD is in there.
Well, who knows? But there has been money. There has been money. AOD.
And I think that will be hard to take out again. So it'll be interesting to see. Maybe we end up with, because there's nothing like a national crisis to make us prioritise those things.
Correct.
And maybe that prioritising will linger post the pandemic. Let's hope. Yeah.
Well, as we've mentioned just before the interview, was this idea of the hard part is going to be rescinding it all.
Yeah.
Once the decision's been made that it's out there, then it's going to be really, really difficult to wind it back. So you're right. They are a lot of positives. Absolutely. Yeah. And I think that idea of working more efficiently is a really good one, and particularly around meetings and connections and what's actually required and what's not. And the benefits of the workplace. I mean, my benefit would be the printer is really, really helpful. And
I know, I miss my printer.
So the trees are probably like, thank you, we're not using all and I think that idea that you had around connecting people in, virtual lunch rooms and that, that camaraderie that you have in the workplace is difficult to replicate in your home, but there's ways that you can still connect. So
we're also going to have to, I think we're all learning how to much more consciously switch on and off from work.
Yes.
Because we're doing work in our home environments, those of us like me who are really bad at switching off and going, okay, that's the end of work time, I'm having to get much better at it. And, and I think that's actually a really healthy thing that I'm going to hopefully maintain post this period,
I'm going to keep you accountable. I'll be checking with you, Venetia. But thank you so much for sharing. Thank you for spending this time, answering these questions and just sharing what you're doing personally and at Thorne Harbour. It's been really insightful. I think there's a lot of wisdom in what you've said. And also that offer of just, being available for secondary consults for people, I think is fantastic as well.
Yeah. No, I really mean that, people should feel free to contact us.
So I will get the best contact number as well of you. That in the YouTube comments, so that you're not getting all those phone calls.
No, I'm not going to give you my personal.
There's a boundary there. But I'm very grateful for your time and for your contribution. Thank you so much.
I think it's a great idea, Naomi. I was saying before we started that I think it actually is a really good idea to capture the changes that are happening in how we work, and I think it's really important. So good on you.
And also, I think, as we were talking about before, is how do you keep momentum and commitment in the change? And perhaps we can reflect on some of these things and how we felt at this point and reignite that down the track if need be. So amazing. Thank you so much.
You're welcome.
Ciao.